teacher, let me tell you what I make. I make learning a privilege, not a chore, and frustration a tool, not an obstacle. I make working hard seem easy and giving up impossible. I make an old subject feel like a fresh thought and unconventional methods common. I'm a teacher. I make more.
You're watching WCSD from Calloway County High School.
Everyone is going to need health care of some kind eventually. Today, we are going to talk about the different ways the local health department reaches out to our community. Hello everyone, I'm Claire Whiteside and I'm here with Amy Ferguson, the health director, and Laura Benson, the nurse supervisor from the health department. So how are y'all today?
Doing very well. How are you today?
I'm doing great. Thanks so much for coming.
Thank you for having us.
Okay, so let's start with what are the different services provided at the health department?
Okay, well, the health department provides what's called public core services, and these are services that are required of local health departments to provide. These are determined from the Department for Public Health, and they fall into different categories. One of them is women's health, and through that program we provide family planning and breast and cervical cancer screenings. We also have another service called maternal and child health. And through that division, we provide prenatal care, hand screening, newborn screenings, if not done at the hospital. We provide WIC services, well child exams, lead screenings and referrals, grief counseling, childhood lead poisoning case management, and medical nutrition therapy. And I thought we might want to talk about just a couple of these services under maternal and child health because these are some of our more popular programs or programs that is only provided through the health department. So would we have a minute to do that?
Yes.
Okay.
Yes, go ahead.
Can we start with the HANDS program, because that is a program that is only provided through the health department, and it's a very popular service that we have.
Yes.
So I'm going to let Laura talk about that for a minute.
Okay, well with HANDS we do home visits with parents. We try to get parents in while that they're pregnant, and we provide services about building a relationship with the baby before the baby's born. After the baby's born, we visit once a week with them and we talk to them about basic care, and we talk about social and emotional development, physical development, brain development, and all of those wonderful things. And basically it goes right along with the governor's drive to school readiness. So parents who participate and children who participate in the HANDS program have a head start in getting ready for that. We have several families in the program, and we do visit them weekly until they're about 15 to 18 months, and then it's every 2 weeks until they're 2 years old is when we're usually done.
Now, for the HANDS program, is this more seen in younger mothers than older mothers, or a little bit of both, or?
Actually, it covers a wide socioeconomic and a wide age range. I've had young women as young as 13, and then I've had some women who were working their second master's degree that I have worked with in the program, and I have 2 other ladies that do home visitations, and there is a wide range of ages and personalities, cultures, and everything that is served through the program.
Are there any other different programs y'all provide?
Yes, we also provide the WIC program. Women, Infants, and Children is what WIC stands for, and WIC is a federally funded nutrition program that serves pregnant women, breastfeeding women, and postpartum women up to 6 months postpartum, as well as children up to age 5. And we provide nutritionally adequate foods based on that stage in their lifestyle. And we also provide nutrition education and a healthy food package that goes along with that program. And right now we have about 1,000 participants on WIC in Calloway County.
Oh wow, that's amazing.
Mm-hmm. It's a very beneficial program.
Is there any other programs in the maternal area that y'all would like to talk about?
Let's see, we do some well child exams through the health department. Would you like to talk about what's performed during a well child exam?
During the well child exam, the child it's a head to toe exam. The nurses are trained to do that. They check their hearing, their vision, they listen to them, their heart, their lungs. It can be done there at the health department at the same time that they receive their immunizations, or the well child exam can be done at the doctor's office as well. So.
Okay, and those are just 2 or 3 of our bigger programs and services that we provide. Some other services that we provide that are required through our state office is environmental services. And our environmentalists provide a wide variety of health inspections throughout our community just to make sure that our community stays safe. They inspect our food service establishments, our retail food service establishments. They check our hotels, our motels, our swimming pools, all of the RV parks, tattoo parlors, schools, youth camps, all of these different places to make sure that these facilities are working according to the guidelines that will keep our community safe.
Okay, so we have nothing to worry about when we go eat at different restaurants.
They do a great job at inspecting, so yes, they stay on top of things.
Mm-hmm. Are there any other services through the health department? That,
yes.
Oh.
We also provide the communicable disease surveillance. So we provide outbreak reporting and referral, outbreak investigations, as well as STD testing and treatment, HIV services and Hep C testing, and TB screening and testing, as well as TB directly observed treatment. Did you want to add anything to that? Mm-hmm. Okay. And then we also provide some preparedness. We are involved in preparedness and disaster planning with some other community members. So if we were to have a disaster here in Calloway County, the health department would play a role in helping take care of that.
Well, all right, so we're going to take a quick break and we'll be right back.
Think about, what am I doing right now?
Smile. Smile?
Uh-huh.
This is so easy.
And next question we have for them is, what are the benefits of using the health department versus going to the hospital or something like that?
Okay, well, the two agencies are different. The health department is a governmental nonprofit agency, and we are geared more towards preventive care. So within our health department, we do not employ a physician, and we do not provide treatment for conditions. We do employ registered nurses, licensed practical nurses, and a registered dietitian. So those are the clinicians within our local health department. So anything that the nurses might determine to be a problem, they would make a referral to that patient's healthcare provider, but we do not provide any type of treatment.
So confidentiality at your office is a big deal. How does that work?
Our records we're all bound by the HIPAA standards, which means that we won't share any information without specific permission from the individual, and we hold that very dear to our hearts, not only because that we want to respect our clients and the people who come to the health department, but also because, it is a federal law. But the main reason we want to take care of that is because we respect our families and we respect our clients, and we want to hold that information the way it should be done.
So, what are some of the different scenarios where, like, maybe a parent would want to know information about their kid or something like that? Like if you had a kid come in there and they were wanting to get some kind of help, but they didn't want their mom to know, and then their mom came in there and was asking about it, y'all couldn't give parents information or anything?
We can provide information about, like, vaccinations, those type of things. There are some things that are covered by confidentiality clauses for people under 18 that would disallow us to be able to share that information with their parents.
I understand that the health department is popular for giving vaccinations, like you just said.
Yeah.
What are all the different vaccinations y'all provide?
Okay, so we have a set schedule. Each schedule is different. Some doctors' offices are different. Some of the other states are different. But as a general rule, children who come into the health department, they'll receive vaccines for diphtheria, tetanus, pertussis, hepatitis B, polio, Prevnar for pneumococcal meningitis, and they also get Rotatek, which protects from the rotavirus. They'll get those vaccines at 2 months, 4 months, and 6 months. At 1 year, they receive another pneumococcal vaccine. They get a varicella for chickenpox. They get a vaccine to prevent measles, mumps, rubella. They also get a polio. Then at 15 months, they have another diphtheria, tetanus, pertussis, and a Haemophilus influenza, and at 18 months a hepatitis A. So then the next immunizations will be at 4 years, and then the next will be at entry to 6th grade. So we cover a wide variety of vaccines.
So y'all are responsible for carrying out a lot of the education for the community. Mm-hmm. What are the different classes and courses you offer?
Okay, our classes and nutrition education and education in general that we provide goes along with healthy behavior. So during our education, we are trying to change behavior. And currently, this fiscal year, the classes that we are providing are diabetes education, which is diabetes self-management, where we are teaching people who are living with diabetes how to self-manage. We also provide a freedom from smoking class in which we're teaching that tobacco user how to be able to cope with quitting tobacco use. And these classes are provided face-to-face. However, we do have fact sheets, references, and that type of thing that we provide to the community as well. And that might be through media, like the newspaper. We do a lot of newspaper advertisements because we feel like that reaches a lot of people. We have some billboards, and we do some radio advertisement as well.
Are these different classes and information about your courses offered on your website?
There is some general information about our classes on our website. However, we do not actually have specific dates for the classes on our website at this time.
All right, so I was watching the local news the other day, and they were talking about a new bill proposed in the state legislature that as a high school requirement, you should, before you graduate, you should be CPR certified. What is y'all's input on that?
I think that it would be a benefit to the community to have people who know what to do in case of an emergency. You know, you have something happen in a store, that you would be able to take care of them and offer support and to be able to help people in need.
I agree with that.
So what are some of the popular reasons that people come to the health department in our community?
People come to our health department for the WIC program. Like I said earlier, we have about 1,000 participants on the program at the current time. So we see a lot of participants for WIC. We do a lot of immunizations at the health department. And of course, children are coming in for their well child exams or their school physicals, you know, during certain times of year. And we have people coming in for medical nutrition therapy as well.
Is there anything? Oh, go ahead. Sorry.
I'm sorry.
I was going to ask you if there was anything you would like to add to that.
Well, it's just the immunizations. You know, one of the questions that some people ask is why are immunizations so important? And it's because that it prevents your children from getting sick. And we've seen pockets of outbreaks. We had a recent outbreak of pertussis. We had someone with chicken pox. There's an outbreak of mumps in another state. These are diseases that can be prevented by getting your child vaccinated and keeping them safe. There are some people who feel that vaccines are dangerous to their children, but there's a lot more proof or more studies that show that it's more important to have them vaccinated. The pediatricians in the area are very pro-vaccine, and one of them shared with me that before that the rotavirus vaccine was introduced, that they would have up to 10 children in the hospital each spring with rotavirus, where now they have maybe 1 or 2. So it does make a difference in getting those vaccines.
Well, there you have it for today, folks, and be sure to check out the health department for the different services that you can have provided for yourself.